You can kind of feel the scapular spine at the, let's see, yeah, at the top of the scapula. And I'm just gonna work from the medial corner and work my way out laterally. Okay. And again, I just start off with pressing, and I just walk my way out laterally. Okay, and then after we've worked on the supraspinatus, then we move on to the infraspinatus. So infraspinatus is this large flat area of the scapula right here. This is a really good place to practice the palpation because it's flat and the muscle is not super deep. So, it's a good place to practice feeling for, I don't know, differences in tissue.
Are you here?
Yeah, exactly. It's that large triangular area.
Yeah, kind of like a deer.
Yeah. So, again, I use the pads of my fingers, and I just try to feel for any, yeah, usually on this area, I feel it as like, I don't know, like holes or things like that. And then if I find a spot, then I'll apply direct pressure onto it. When you press onto a tight spot like a knot, again, don't, I mean, I make this mistake all the time, but don't just like stab yourself in. Just try to, yeah. Although, I mean, honestly, I sometimes I just go right in by mistake. So we've worked on the supraspinatus, the infraspinatus. After that, another good area to work on is the lateral edge of the scapula here. Okay. So just like when we were working on the medial edge, all we do is we can start from the bottom corner, and this edge kind of is diagonal this way, but we just apply pressure just like we're trying to dig under the scapula. So I go from this side, and I apply pressure this way, okay, perpendicular to that edge of that scapula. And I just walk my way up. Sorry. Okay. This is also a good place to practice like grabbing the tissue. So with my whole hand, you can grasp this tissue that is behind the armpit on this side. Okay. You can also move on to the arm if you have time, and if you, like, say you really wanted to focus on the arms, the back of the arms, then this is a good position to move right into working the arms here. So you can practice the grabbing and arms. Most of the time, though, I do a lot of shoulder work, but my emphasis is going to be on the back. So I don't always move on to the arms at this point. Okay. I think I also mentioned in the notes that you can also stand across the body, reach around to like the side of the rib cage, and then just using your fingers, you can kind of put pressure and do some kneading in this area. problem with this area is that it can be really ticklish or whatever, or sensitive. Yeah, but it, sorry.
Take out more pressure.
Yeah, the thing is that there are important muscles there, like there's a they call it your serratus anterior. It's related to your shoulder as well. So sometimes I work on that.
I wonder if I do it on my dog with it, like, yeah, that's the area.
Oh.
You know the dogs.
Yeah,
they go.
the leg shake.
Yeah.
That's what happens to me too.
Yeah.
Okay, so
I'll try that, but I go home just.
okay, so far I've worked on the primarily like this upper back and the shoulder area. Yeah. So from there I move on to more like the mid back. Okay. So you know, because of this overreach issue, usually if you're going to work on like from the mid back down, it's better to work one side at a time and you know, go from the opposite side. And like when you're doing your push, you're pushing this way. I'm sorry, your press.
We're on 17 now?
I think so, yeah.
That's forward, right?
Yeah. And then I go right into doing more penetrative stuff. Okay. So again, you can kind of you know, target your treatment more if you palpate first and then apply pressure on what you feel, or if you just want to, you know, if you don't have time or whatever, you can just, you know, inch your way down the back this way. But usually when I'm doing this kind of pressing, I do it one side at a time from the side. There are ways to do it this way, but again, there's, especially on tall patients, it becomes like an overreach issue when you get down here. So I think it's safer for, you know, body mechanics wise to just work one side at a time and you know, apply pressure on the height of the paraspinal at that level. You can do some kneading. You know, again, if you're more comfortable, you can use your fingers. You can use your knuckles. I'm kind of doing this a little faster than I'm. You can also go into using your elbow if you have enough control. Okay. So if I feel like a tight spot here, then I would rest my elbow here. My other hand would kind of surround the elbow joint, so it sort of acts as like a template or a brace. You know. And then I'm not applying very much pressure at this point. But if I really want to focus on the point, then I just start to gradually bend my elbow. The point of the elbow becomes more acute, and then it's able to apply more focused pressure onto that spot. But you always want to start off with your arm at a wide angle, just so you you know, you gradually introduce the pressure instead of like all of a sudden like stabbing into the point.
Oh, not me. I come like that. It's so scary. So I didn't know that. I didn't know you.
Oh, okay.
Yeah, I thought elbow is.
It's.
I honestly, I thought, oh, what a good tool. It's pretty sharp.
So I feel some more stuff down here. So I do the same. Again, this is more like the spot treatment, you know. So I start off with my elbow open, pretty wide, and then I just gradually bend.
I mean, is that part is a potential spot like the shoulder? That's not a problem area for most people. Is
The shoulder?
What you're working on, the mid back?
Mid back? No, I think a lot of people have tension in the mid back.
Oh.
Yeah. Yeah.
That phone just went off.
Okay, no problem. Okay. Wait. Before you go.